Hey, folks, welcome back to another episode of the Change Physician Podcast. This is your host, Dr. Kevin Cuccaro, with my wonderful co-host, Dr. Melissa Cady, and today's returning guest, Dr. Paul Thomas. If you have not seen our previous episode with Dr. Thomas, you definitely need to listen to that or watch it if you're on YouTube, where he was talking about his experiences in creating his direct primary care practice. So Dr. Thomas is a physician in the Detroit metro area, and he's got Plum Health Direct Primary Care. Fantastic episode, but of course we always have more to discuss than we can fit into one episode. And specifically for this one, what Paul is going to be talking about is starting a direct primary care practice as an early physician, because in his case, he did it basically right out of residency. So if you're an advocate, if you're interested in sort of taking care of your practice, your environment, if you are a primary care specialist, or maybe not a primary care specialist, but just interested in a new sort of business model when it comes to delivering care, this should be a great episode. And Paul, it's fantastic to have you back on the Change Physician.
Hey, thanks for having me. Great to be here.
Awesome.
So let's start off, and we did a little bit of this in the first episode, but if you can kind of just recap why you were interested in direct primary care and then how you started that journey, so that you were ready to hit the ground running when you finished your residency.
Yeah, going through residency, as I progressed through my training, I had less and less time with my patients. And I thought the whole point of medicine was to have, 30 minutes or an hour with each of your patients to really understand who they are. And by the end of my residency, I found out that that's not true. You typically have 15 to 20 minutes at most. And it feels like you're running on a treadmill or catching sand or drinking from a fire hose, whatever metaphor you want to use. And it's just not a comfortable feeling practicing medicine like that. And then I looked around at my attendings, who are all very good people, dedicated, doing medicine for the right reasons, but they were always grumbling about prior authorizations and the big headaches of the day, too many patients in the schedule, not enough time to dedicate to those individuals, and then the documentation requirements and the prior authorizations. And so I was thinking, how can I get out of that system, but still practice medicine and still be of service to my neighbors and my community? And that's when I remembered hearing about direct primary care. I set out in the last year of my residency program to learn as much as I could. I wrote a business plan in late 2015, early 2016. And then I did a road trip where I visited a couple successful direct primary care practices across the country in March of 2016. And I graduated at the end of June 2016, and I launched my practice in November. So it was a little bit of a whirlwind. I learned a ton in those months, but I ended up launching a successful practice, and we slowly built it into what it is today.
So let's kind of delve into that a little bit here, because there's a couple things that I'm thinking would be fear-producing in a physician who tends to be risk averse. Like, you're already coming out and you have however many tens of thousands or hundreds of thousands of debt. And so now we're talking about infrastructure, getting the space that you're going to create this practice in. And then also the model itself, because it's a membership model. So you have to recruit members. So what was your initial foray there? How did you find the space that you could afford? And then how did you recruit members to your practice?
Yeah, doctors are risk averse. As physicians, we're encouraged to leave no stone unturned. And then mistakes are punished on rounds and in hospitals rather than celebrated as they are in the business community. And so having that mindset shift from, a doctor to a businessman or a business person is important if you're planning on starting your own direct primary care practice. And I'll pick up on what you said about student loan debt. When I graduated, I had the average amount of student loan debt for a 2013 medical school graduate, and that was $170,000. And in 2019, it's $193,000. So you're looking at that debt load and trying to figure out how you can pay that down, but still practice medicine on your own terms. And so what I did is I started writing about my journey in residency and saying, I want to start this practice called Plum Health. It's going to be a direct primary care service. Here's how it's different. And I tried to do that every week. I wrote a new blog post. I talked about our brand. I talked about our logo, what it meant, what it means to me, how we're going to make an impact. And people started signing up. It was crazy. I didn't have an actual practice. I just had a web page and a blog posts every now and then. And I had a few people signing up. And as I had more and more people sign up, I got closer and closer to thinking I was ready to launch. And I never really did until somebody called me. It was November 8th. And they said, Dr. Thomas, I signed up for your practice. I know you sent me an email and said you weren't officially open yet, but whatever you're going to do, you need to do it now because I just took my last pill of Lexapro. I don't have insurance. I don't have a doctor, and I need you to help me. And so I ordered from my wholesale supplier like $100 worth of medications, which seemed like a lot of money at that time. And it delivered to me the next morning because it has overnight delivery. And I made a house call for this guy November 9th around, I think, 1 o'clock. And that was my first visit of my direct primary care practice ever. And it was the need of somebody in my community that drove me to start. And I probably never would have started unless that guy had called me out and told me to, get it in gear, so to speak. So I didn't have a space when I first started. I didn't have an office space. I was a house call doctor for the first 2 months of my practice. And that didn't go great. I had a few people sign up throughout those first few months. But then when I found a practice space, I actually leased it from a school in my community. There's a school for digital technology. It came with free Wi-Fi, a printer. There were some shared bathrooms down the hall. And I had this one room, 180 square foot office that I practiced out of for the first 3 years of my practice. And it worked out great. I built up my panel over that first 3 years to about 550 patients. And I hired a second doctor. We took over the next classroom adjacent, another 180 square feet. And then we built out this larger, beautiful office where I'm sitting today, about 3 years into it.
Wow. That it was really good to hear you say, because there's so many things, even I can relate to this too, is that you have ideas, you want to do certain things, and sometimes you start putting it out there, but then sometimes it's, to kind of get over that fear or that hesitation, it's almost like it takes somebody outside yourself to help you kind of get over that that last little hump of anxiety or fear or hesitation or doubt. And I think that's I think it's amazing. I mean, that patient obviously deserves credit for that, but they really, really needed you. And I think that's what kind of pulls us in a direction that we probably wouldn't do for ourselves. And I assume that there's just a momentum that kept building from there, obviously. But I'm curious, when you found that location or finding a spot, did you look up certain things that were available, or is it a relationship with somebody that you already had that kind of presented that opportunity? How did you find that?
Yeah, well, Detroit is unique in that it's been medically underserved for so long, and there are very few private practice physicians in the city of Detroit. There's FQHCs, and then there's some large hospital systems and healthcare juggernauts, so to speak, in the Detroit area. So you can't really go to medical office suite and buy, lease out a small office. It just doesn't exist. There isn't that much Class A medical space, and the stuff that is available is within those juggernauts. And they're not going to lease to a third-party vendor like myself. They're not going to lease to a doctor outside of their system that doesn't, bill insurance or refer in their network. And so it was a very big challenge. And that's why I leased from a school, because it was a professional-ish building. It was, nice enough. It was comfortable. It was in the community, and it was a safe place to start my work. And my patients felt welcomed and comfortable there. And so that space was a tremendous gift in being able to find that. And, it just worked out. It worked out well. And I'm really happy that I was able to find that spot.
And to rewind from that, you obviously didn't have to have a place to actually help people in the kind of practice that you have. And the first thing you just needed to be able to do was find medications that were very inexpensive. And so I think it's interesting for new residents are figuring out how to maybe go through that process of ordering it or who to order from. how did you, can you explain kind of what people should expect if they want to establish at least that, if they're going to be making house calls?
Sure. Yeah. So I bought a leather doctor's bag. It was kind of like my launch gift to myself. I had this beautiful leather doctor's bag. I bought a stethoscope. I have a stethoscope. I bought a blood pressure cuff, pulse oximeter, thermometer, probe, and then I bought boxes of gloves. I set up a vendor relationship with Quest Diagnostics, so I could draw blood and then send it to Quest, or collect urine samples, treat people for UTIs and things like that. Send it over to Quest that way. And then I worked with Andameds out of Florida, and I set up as them as my wholesale provider for medications. And so those key vendors are important, and you can do that anytime after you establish an LLC. So I had a PLLC. And one of the first steps you take is set up a LLC, in our case, a PLLC, because we're professionals, a professional limited liability corporation. And then you go to the bank, it's crazy. My grandma gave me like $90 or something for Christmas or whatever, or my birthday, I can't remember which. And I took it over to the bank and deposited that $90. And that was like the first investment in Plum Health. And then I had a bank account with that small amount of money. But you need that, and then you need like a tax ID number. So I sought out an accountant. I paid them like $200 to set me up with a couple things, and like a tax ID number. I set up QuickBooks so I could track all of my expenses, and those are kind of like the basic bones of a functioning business. And then as you do more things, as you deliver different levels of care for different people, you need to buy different things. So I eventually bought an EKG machine and a spirometer from places like Henry Schein and other large, supply vendors like that. And then, eventually we buy like, $1,700 exam table for our office, and, those things that you need, but you don't need everything at once. And one of the analogies I make, it's like building a plane as you take off, because at essence, what we give patients is our time and our attention. Never underestimate the power that you have with your brain and your stethoscope, and then everything else you add on to that is a value add for your patients.
Yeah,
I think that's really important, and I'm also kind of looking at this from the risk averse physician kind of lens, because what you have basically described so far, and I just love it, is the fact that a physician can basically can create a business with very little overhead, simply with the education that they have. Because you get your your LLC is not that hard. It may seem intimidating, but depending on your state, that's sometimes $50, and it's a little couple pages. It's really easy to do. Your tax ID, it's another thing. It's not your biochemistry exam. I mean, it's pretty easy to do. Of setting up a bank account, again, there's a little bit of time in there. And then I loved, this is the first time I've ever heard of someone, you started it and you didn't even have a structure. You're doing house calls, and immediately I'm thinking, anybody could do that. You could basically create a house call business from the get-go and start building a membership model with that. And
exactly.
So
yeah, and then another one I forgot to mention, med mal, so medical malpractice. A lot of doctors get freaked out about this, but it was, I think, $1,400 every 3 months. So about, I don't know, $433 every month to have, medical malpractice insurance. That's, a reasonable level of coverage for a primary care physician. And that's significantly higher in the state of Michigan and in Detroit, because Detroit's a little bit more litigious than the rest of the state. So our costs are a little bit higher because of that. So maybe even less for you in your state or your county, depending where you're at.
Yeah. And something I just wanted to add, just for those listening out there, is that, if you didn't know like how to set up an LLC or PLLC, you can go to an accountant. You can establish them as a registered agent, especially if you're working out of your home to do house calls, and you don't have to utilize your own personal home address for establishing that entity, so that anything they're looking up online, they're not necessarily going to find you. They'll find the registered agent for your PLLC or your LLC. And many times you were talking about being able to order things based on your entity. As a physician, you have an NPI or national provider identification number, but sometimes once you create an entity, many people don't know this, you might have to get a second NPI, which is more connected to your entity. So those are little things. They're just nuances that they don't take a lot of time. They're just nitpicky. But I wanted to insert them there because I think these are things you don't know and you just learn along the way, or you say, oops, forgot.
Yeah, or you can set up a PO box, at your local
do that too. Yeah, exactly.
Post office, and that way you can have your LLC registered to that PO box until you get a physical address.
Yeah. And sometimes they'll try to say, what's your actual physical address if you have a practice. So in that case, you might be able to figure something else, but PO box are really helpful.
Oh, yeah. Or with the rise of co-working spaces, you can register at a co-working space and have sometimes a membership there might be $50 a month to have a mailbox and a hot desk. You can come in when you want, do some charting, do some paperwork, and check your mailbox.
Yeah, good point.
Well, let's kind of go from there. So you have like the minimal viable clinic, right? It's you got your documentation, you have your insurance, all of which we kind of talked about. Isn't this? It's not, I'm going to say it's not neurosurgery. The next fear I could see people having is, okay, if I'm out and I'm starting, and now I'm like Paul here, and I'm doing house calls to start. For the first couple of months, I'm just doing house calls. And you said you're building this airplane. What do you know? Like, you started with your stethoscope, your blood pressure cuff, like the basic stuff. But I can see someone thinking, what if I get into a scenario and I need super fancy incentive spirometry here, or I need the EKG machine? What did you do in those scenarios when you didn't have that equipment right when you were starting?
Fortunately, it didn't come up. I bought the stuff relatively early on. So I started in November. I got the physical office in January, and then I invited everybody in my contact network. Hey, come to my new office. Let's schedule a time. I'd love to show you around the new office, sit down, talk about our practice, and tell me what you're up to. And so I got a lot of new members that way. Once I had the, office space, I started getting like 20, 25 new members each month. So we really grew rapidly after we had that physical office space. And then in March, I ordered the PFT machine. And then in March also, I ordered the EKG machine. And so I had enough revenue to buy those items and to break even in that first year. So, worst came to worst, if I needed to do something, I guess I could send somebody to the urgent care or the ER if I was really that concerned. But fortunately, it didn't come up that way. And I had everything that I needed when I needed it.
That was kind of what I was looking for, because I was thinking in a traditional practice, what do people do when they don't have the resources?
Yeah,
there's the emergency department.
Yeah, or you refer, and you do your best for every patient, but you also have to make sure that everybody is safe. And if you don't have the right equipment, you have to refer them, send them to the urgent care, send them to the ER if necessary. And we all do that. This month somebody comes in with a swollen leg and some concerning history of being sedentary for too long, and you might have a DVT. We got to send you over, and sure enough, there it is. And I don't have that equipment at an outpatient facility. You need to go to the emergency department, be evaluated by the vascular surgeon there to make sure that this isn't going to cause a massive PE or something like that. And so we all face that to some degree. And when you're first starting, that threshold may be lower, that threshold to refer out if you don't have the right equipment.
And I know I'm kind of beating on this a little bit, but I keep coming from this kind of fear-averse kind of mindset, because the other thing I can see is, if I have to refer out, then obviously I can't start the practice because I'm not doing a good job as a doctor. I don't have these tools. And I would argue, and I would love your opinion on this, is even in the situations where you're referring out because you may not have the equipment, you are still providing significant value to your members through reassurance, through the evaluation, through, I'm sure that you're following them through this process. Because could you kind of comment on a little bit there? Because I just want, we don't value ourselves as physicians. I can just see a young doc saying, I can't do this unless everything is absolutely perfect. And
yeah. I mean, I only have about 480 patients or members in my practice at this point, and I'm, full. And what that allows me to do is spend time with people, develop trusting relationships, and then be there for them in their hour of greatest need. So if you cut yourself, I'm able to sew it up with a laceration repair kit that costs about $20, and I don't have to charge you for it because it's only $20. And if you do need to go to the hospital, I can meet you there. I had a patient with a very complicated medical history who is a shut-in, and he eventually needed to go to the emergency department for something. So I met him there with his medical records on a thumb drive. And I sat down with the ER doctor at the large health system in the community who I knew from my medical school training. And I talked to him for about 20 minutes about all of his history and all the things that I wanted to accomplish out of his visit to the hospital, because I knew he wasn't going to get out of his house very often because of his condition. And then I talked with the family for 20 minutes in the ER and just went over everything and called the internist when they were admitted to the floors every day just to make sure that they were progressing well. And then eventually they were sent to rehab. I followed up with the rehab physician and the staff there. And I was that constant presence throughout that entire interaction to make sure that nothing was lost or missed and that they had continuity of care throughout the process. And that's extremely valuable for patients. Even though you can't do anything for them in the hospital, you can still remind the physician who's taking care of them that somebody's watching and that they'll get better care because of that. And then you'll be that consistent presence and that repository of medical information about their care over that interaction.
That just gives me chills. I this is the way medicine should be across the country, period. And I know you know that you're doing something important. When you said you're not doing anything, you're being such a huge advocate and enabling a continuity of care, even in a different setting, that is remarkably powerful for the patients. My one question, based on what you just recently said, we have to tap into this, is when you were going to make house calls, did you have a pen and paper in your leather bag? Or did you already start with some kind of medical record?
No, I had a medical record system. I use Atlas. It's a web-based, so I could either type it up on my phone or I could pull up my laptop if it was longer, more complicated, and I could type into the EMR and use my phone as a hotspot and document that way. And then also, you can take down the vital signs and put in medication orders. I could send a medication to a pharmacy if I didn't have it, right from their home if they needed it, or call it in for them. That's all part of the package, all part of the care plan.
Nice. And was that expensive for you starting out?
No, that's another thing. Oh my God, I'm going to have to get Epic. That's $500,000 to install it in just one practice. And there are EMRs, or electronic medical records, specifically for direct primary care practices. Half the doctors that do this use Atlas. The other half use Hint and Elation. So Atlas, it allows you to take notes, take vitals. It does a medication inventory, and it has a billing platform all in one. So it's a nice, $300 a month, and it's an all-in-one solution. It's easy to use. And then Hint and Elation, they have a little bit more, finesse. There's a little bit more like analytics and data stuff you can do with their platforms. And it's a little bit more slick, but it's two separate platforms that you have to put together. And then some people add in Spruce for like a messaging application. So there's a lot of different tools out there. And that one, it's a little bit more complicated on pricing. I'd say probably in the $450 range. Plus they take a little percentage based on your number of patients. So, it's not terribly expensive, but it's something to consider. I think all in, if you're looking at a low overhead office, you can get by on about $5,000 a month in overhead. And then if you get into a larger office like the one I'm in now, perhaps your overhead gets to $10,000 or more, depending on your square footage and the staff that you have and all that kind of ancillary stuff. But you can run a really effective solo DPC practice in a small space by yourself for about $5,000. And if you get into a larger space and have staff, maybe it's $10,000 a month, depending on your payroll and rent.
And what's great about that, though, too, is your infrastructure can grow as your practice grows. You're not like in a traditional medical practice where you have to invest to, if you're trying to do a standard medical model and to open a practice, it is not an inexpensive venture without having, and you still have to recruit all your patients. So this is a great way that you can actually start. And like you did, you start house calls, you can start with 180 square foot space and then grow as your practice grows. So
yep. And that's one of the cool things about my practice is, in my first year, I was moonlighting in urgent care. I worked one weekday and one weekend day, and then I worked 4 days at Plum Health. And so it allowed me to, grow without too much stress on myself. I was making a decent income at the urgent care, a little bit more than I made as a resident, but not like a full attending salary, of course. And it allowed me to grow from, basically 8 patients to about 125, 150 patients in my first year. And that allowed me to break even where I could pay myself and leave the urgent care and still run have a profit every month. And so just about every month we've had a, small profit margin throughout the 4 years of running Plum Health. And then every month we add something in, either a medical assistant, a larger space, another doctor, et cetera. You buy the deluxe exam table or the pill counting machine or whatever it is that's going to make your job easier. And you can do it in kind of an incremental way where you're never drowning in debt or feeling overwhelmed by the cost of practice, because you have a consistent revenue stream. And that is, you're delivering excellent care to your patients and they want to keep you as their doctor. So they're going to continue to pay that $50 or $70 or $90 a month or whatever your price point is to keep employing you as their doctor.
You make me think about how strong the case is for residents that are even contemplating direct primary care to go into it from the get-go with the idea that you're used to your resident salary and it's kind of a graduated entry into, a different standard of living that you could do what you said, like 1 or 2 days, maybe do a couple days a week in a way where you're not overly committed. It gives you the time to create the thing that you're worried about whether or not you'll be able to afford starting a new practice, but you make some income that you can put into that new business. But as you transition and start shifting into your direct primary care business, it just seems like a smooth entry where you're gradually increasing your income, or maybe just around the resident salary, depending on how much time you're putting in outside the direct primary care and how quickly it grows. It just seems like a much more beautiful way to just start then before your standard of living gets to a certain level.
Yeah. And that's what I tell doctors who want to do this. In my book, I write, reasons not to become a direct primary care doctor. And if you love the paycheck and you're risk averse, don't do direct primary care, because you're not going to replicate your doctor's salary on day one of your DPC practice. And so if you're, making $200,000 a year and you cut that off and start a DPC practice, it's probably going to take you at least 2 years to get to that full panel where you're making that kind of income again. So it is easier to do it right out of residency, because you don't have that hesitation about losing that large salary, because you never had in the first place.
That's right.
And you can just kind of build it organically over time. Yeah. And it works out in the end, because then you are invested in a practice that you'll have enough time to spend with your patients. You're not going to feel burnt out or overwhelmed, because you have enough time with your patients, and you're practicing on your own terms, which is a beautiful part of this whole equation.
Yeah.
And in many ways, it seems like this is a safer route in so many different forms, meaning there's fear, right? But the fear is more of the unknown and uncertainty rather than, then I'm trying to think of it. The thing that's keeping people from DPC is the fear of the uncertainty and the newness, versus in a standard practice, that is not a risk-free phenomenon in any way, shape, or form. If you think of somebody who's leaving residency and you get your first contract and you're like, oh yeah, I'm going to make 200,000 or 250,000 or whatever, but then I'm going to move across the country, and then we're dumb, and then we buy a house and we do all this other stuff, and then all of a sudden you discover that all the thing they told you about in this new practice environment wasn't exactly what they told you. That maybe the fancy brochure that they gave you, you really don't know what a practice is like until you are actually practicing in that practice. And then now you have the non-compete clause. So now you've moved and you have these non-compete clauses that have 25 to 30 miles to, in the worst case scenarios, a 50-mile radius around practice locations. That, from personal experience, seems a lot more risky than what you were talking about, where it's, start slow. You're creating a practice that you want. You're investing some time. You're working urgent care on the side. That just doesn't seem nearly as much, other than the fear of the unknown. It just doesn't seem as risky to me. And
yeah, totally. I mean, sometimes people can get in bad situations because they're, sold a bag of goods, so to speak, where they're thinking, oh yeah, I'm going to easily make, $250K, and I'm going to buy this big house, join the country club, buy the car I've always wanted. And then it turns out you have to see 35 patients a day to make that kind of income. And you are in this rat race where you can never really keep up, and you're drowning in those, documentation requirements and prior authorization forms. And it just is not a good feeling. And, I've talked to doctors who feel this way. They feel trapped by a bad system. And I think direct primary care offers, it's not a perfect solution, but it offers a better alternative, in my opinion, to practicing medicine on your own terms and to the best benefit of your patient population.
Yeah. So can I ask you one question though, just kind of get more nuts and bolts in here, is what were your top growth strategies? Because obviously if you're just starting out and the concern is I need to start generating revenue, you had the foresight to start a blog or a newsletter early on. So that's a fantastic, easy, wonderful way to do it. But then how did you grow? How did you go beyond the first 8 patients? You said you got all your contacts and saw your first office, but what were your primary growth strategies?
Oh man, I did 100 things. So are you ready? So, I mean, I grind, I hustle. They have a saying, Detroit hustles harder. And it's true. I did everything I could to grow my practice. I went to networking events and I met people. I learned all about what they did. And I took their business cards and I followed up with them. I sent everybody, I got a business card, an email, and I connected with them on LinkedIn. I sent them a note on LinkedIn. Hey, I met you at this thing. Great to meet you. And so I was building just a group of people who knew who I was and what I was all about. And then, connecting with people on Facebook and leveraging my personal Facebook page to communicate my value. And then I also created a professional Facebook page for Plum Health DPC. I created a YouTube account. I started doing videos like this, and I'd record them and try to put something up every month at least, just to tell people how I'm doing. You can go on my YouTube channel, go back to like December 2016, and you can see a video of me like with this bag of tools walking into my new one-room office and being like, hey guys, this is my new office. Just taking out these shelves here, going to refinish them. I'm going to make it look great. I'm really excited to practice in this space. I did those little things every month just to do storytelling and share about my journey and where I'm at and where I want to go and what my vision is like. And then beyond that, I just went to a ton of like block clubs. I joined a Corktown Business Association. And I got in front of as many people as I could speak in front of. I spoke at residency programs. I did like the residency program circuit. I still do it every year. I go out to every residency program, just tell them what I do and why it's different. I called nursing care managers, like the discharge coordinators. And I said, listen, if you have a patient who's uninsured, who needs excellent medical care, I wrote letters to the editor for the Detroit News. I reached out to the journalists in our television media. I got a couple interviews there. Those were tremendous in getting the word out. I wrote a TED Talk. I did 2 TED Talks so far, TEDx Detroit. And I really just communicated why I'm doing what I'm doing, what I believe in, and why it's important. And I just done that consistently over the last 4 years. And that's how I grew my practice. It's just that easy.
An overnight success.
Yeah, overnight. Tremendous, rousing overnight success. I snapped my fingers and a genie appeared, granted me all of these patients. And then the most important thing is delivering on your promise, on your brand promise. If you be impeccable with your word and do what you say you're going to do and deliver excellent care to the best of your ability for every patient. And even when you fall short, follow up with them and ask how you can do it better next time.
Yeah.
Awesome.
Well, there's some serious tenacity and belief, and obviously integrity that keeps it following through. We talked about earlier about the fear earlier. I think I had to just mention, to tie it into all this work you did, is that there's that initial, it's what kind of pain are you willing to endure? What pain is worth it to you? Is it the little bit of pain on the front end of the uncertainty and the amount of, groundwork that you did to really kind of put your tentacles, so to speak, out everywhere so that people can receive your message and what you're doing? Or is it the pain on the end, like, Kevin was talking about, that you thought you're getting this immediate gratification of what you really wanted and needed and wanted to avert the fear and all this uncertainty, but in the end, you may not be creating the life you want, the autonomy you want, and these limitations on where you can be and how you can practice. Anyway, kudos to you, because you obviously decided on the latter, of just putting a little bit of, I don't want to say pain, but a lot of work on the front end in order to create what you have now. So,
yeah, I think as doctors, we can all feel that, pain, because, I read about this in my book as well. I had a teacher for a board prep who came to our medical school and was trying to sell the whole board prep course or whatever. And he gets up in front of the room and he says, for your step 1 exam, pain now or pain later. You can either suck it up and do the 7 weeks of intense studying, or you can live in regret of a bad board score, after you take your step 1. And so I think we've all faced that with the MCAT, with step 1, with, applying for residency and, everything in our medical career. You have to put in the kind of effort to get the reward that you want in the end. And I think direct primary care is exactly that.
Yeah. Well said. Kevin?
Not much to add other than you really hustled. And I think if someone did even half of what you were doing, they would be in great shape. So amazing. And I don't want to take up too much of your time. We want to be cognizant of that. I could feel like we could talk again for hours and hours about this stuff, because like Melissa had commented earlier, this is really the way. Well, I know we're preaching the cry here that this is kind of the future of healthcare. Most people need an advocate, and they need a primary care specialist who can be that advocate. And in the traditional medical model, that's not happening. We have great primary care docs, but they're not able to do great primary care because of time constraints and all this other onerous stuff. So this is a model, I think, that really, it just makes a lot of sense. Seems to make a lot of sense from a consumer perspective. And what I loved about the details that you provided is, man, you can just start. I mean, that's just awesome. This is really not that complex. So thank you so much for coming on, giving the details of your early practice. And thank you for doing the great work that you do and continue to do and your mission with Plum Health. I guess, do you have anything else that you want to advocate or say, or tell the listeners where they can find you, or one last nugget of advice?
Yeah, sure. So my name is Dr. Paul Thomas. I'm a family physician. I believe that healthcare should be affordable and accessible. That's why I started Plum Health. People asked me what the hell I was doing. So I wrote my first book about direct primary care. It's called Direct Primary Care. And then a lot of doctors asked me how I became successful in my practice. So I wrote a book called Startup DPC. Both of those are on Amazon. If you want to find me, I'm on plumhealthdpc.com, or you can hit me up on Twitter or Instagram at Plum Health DPC, or on YouTube, youtube.com/PlumHealthDPC. You get the idea. And I'm really happy to answer any questions that any of your listeners might have. And the final piece of advice that I'll give is that it's not the decisions, it's the decisiveness. A lot of times doctors are super hesitant to make a decision because they're told no stone unturned, or they're punished for mistakes like we talked about earlier. But to be successful in business, you have to make quick decisions before you see the full picture. And even if you're wrong, you can always go back and, if you pick the wrong vendor out of 2 good vendors, it's not the end of the world. You can always switch later.
Sure. Well, for those of you that missed the previous episode, you can go back and listen to Dr. Paul Thomas's full story and how he has basically brought the joy into medicine for his community and for himself, specifically primary care. We all could use a little bit more joy in medicine in this country. And so I would definitely heed his advice on where to find some more information. And again, thank you to Dr. Paul Thomas for joining us. I'm Dr. Melissa Cady here with my co-host, Dr. Kevin Cuccaro, and we'll see you on the next episode.